Hi, Mrs. Pearson. My name's April. I'm going to go ahead and do your vitals and assessment. And once we're finished with the full head to toe assessment, we're going to work on the focused postpartum assessment, okay? I'm just washing my hands, providing some privacy, and then I'm going to verify your name and date of birth, okay? So let me check your name band. Okay, Mrs. Pearson, 31104, perfect. Okay, so the first thing that I'm going to do on your focused postpartum assessment, now that we've finished your vitals and your other assessment, is I'm going to start with the breast, okay? I'm going to palpate the breast and also be taking a look at your nipples as well, okay? All right. Okay. Your breasts appear to be soft and filling, which is good. When you're breastfeeding, we expect them to be starting to fill appropriately. I did not notice any dryness or cracking of your nipples, which is good. If you do note any dryness or cracking, let us know. We have some ointments and creams that can be helpful and ease some of that discomfort. I did not notice any painful spots upon palpation. Nothing was red that was hard and swollen, so that all looks good. That just indicates that there's no sign of infection or the early stages of mastitis, okay? The next thing that I'm going to do is I'm going to go ahead and take a look at your abdomen, okay? Your abdomen does appear to be rounded, which is normal. I'm going to go ahead and listen to your bowel sounds. Have you had a bowel movement yet? No? That's okay. Have you noticed if you're at least passing some gas? You are? Okay, good. That's excellent. We would want to see that, okay? I'm going to go ahead now and listen to all 4 bowel sounds. I'm going to repeat that because I went out of order. Okay, Mrs. Pearson, everything sounds good. There is bowel sounds present in all 4 quadrants, okay? Have you had a urination or been able to use the restroom recently to empty your bladder? About 30 minutes ago? Okay, good. So the next thing I'm going to do is I'm going to look at your incision and I'm going to palpate your bladder and your abdomen. Have you had any pain or burning with urination? No? Okay, that's good. I'm going to go ahead and put some gloves on right now so I can take a look at your incision. Okay. Any problems or anything that you've noticed? No? Okay, good. Okay, so the incision looks good. I do not see any redness. I don't see any swelling, bruising, or drainage. It looks like your incision is well approximated, and what that means is that the 2 sides of the incision are just pulled close together, which is good. We would want to see that as well, okay? It's not time for a dressing change right now, so I'm just going to go ahead and put the bandage back over, okay? I'm now going to go ahead and palpate your uterus and just make sure that feels fine, okay? Excellent. Now I'm also going to feel for your fundus, okay? All right, that feels good. It feels nice and firm. It is about 1 fingertip below your belly button, which is what we would expect and what we would like to see, okay? Next, I'm going to go ahead and check your perineum area. Okay, I do notice a moderate amount of rubra, which is completely normal. Obviously, there's no need to check for an episiotomy because you had the C-section. Go ahead and take my gloves off and wash my hands here. Now, with your rubra, we do expect to see the moderate amount of rubra. You'll have that for a few days, okay? If you start to notice any gush of fluid or passing of clots or tissue fragments, you'll want to let us know, okay? The next stage, you'll have the rubra for the first few days, up to 4 days. After that, you're going to go to what's called serosa. It's a light pink in color. You'll have that for a few days, and then you'll go to alba. Alba is a yellowish white discharge that is normal and we would expect. So those are the different phases that you can anticipate, okay? I'm going to go ahead now at this time, and I'm going to put gloves on again. I'm going to check your rectum area for any hemorrhoids or problems, okay? And because I was in your perineum area, I'm going to put a different set of gloves on. Okay, Mrs. Pearson, I do note 2 small hemorrhoids. They're about pea size, nothing to worry about. That's normal as well. If you have any problems with them or they become painful or irritated, just let us know. Okay, wash my hands again really quick. Now, the next thing that I'm going to do is I'm going to check your lower extremities, your legs. And what I'm looking for is any swelling or redness, hard spots. Have you noticed any pain or swelling in your calves? No? Okay. So the first thing I'm going to do is I'm going to start by checking your pulses behind your knees. Okay. Those are both strong and equal, which is good. I'm also going to check your pedal pulses. Okay, those are both strong and equal as well. Now I'm just going to palpate. Muscle tone and everything is good. Your skin is pink, dry, moist, or excuse me, pink, dry, as we would expected. I don't appreciate or note any redness or hard spots on the calves, which is also good, okay? All right. Go ahead and cover you back up. Wash my hands. Now that's all that I need to do for our focused assessment for you, Mom. The next thing I'm going to do is some teaching. Are you okay with that? Okay, good. So we're going to do teaching for the baby, and then we're also going to do some teaching for you. Okay. So the first thing that we're going to go over in regards to the baby is car seat. Do you have a car seat? You do? Okay. Is it new or used? Used? That is okay. Just a couple more follow-up questions, seeing how it is a used car seat. Is it within the expiration date? Okay. And do you know, is it free from any accidents? Okay. So the reason that we ask that is when the car seat is out of the expiration date or it's been in an accident, the entirety of the car seat is compromised and therefore it should not be used. But as long as it's free from an accident and within the expiration date, you're all set. So that's perfect. The next thing I want to talk to you about is how to lay the baby down to sleep. So anytime that you're laying the baby down for a nap or to sleep for the night, we always want you to put the baby flat on their back. This helps decrease the risk of SIDS or sudden infant death syndrome. By putting the baby on the firm, hard mattress, that helps with that, but we also want you to keep the crib free of any stuffed animals, bumpers, blankets, squishy toys, anything like that within the crib should not be there. So basically just the baby on a firm, hard mattress, okay? Any questions on that? All right. So lastly, we're going to talk about shaken baby syndrome. As a new mom, you're adjusting to the baby, getting used to being a mom, reading their cues, understanding what they need, and sometimes that can be difficult and frustrating in those first few weeks. So what we want you to do is when the baby is crying and you're not able to console them or you just need a break, what we want you to do is lay the baby down on their back on a firm mattress and just go ahead and walk away. Take a few minutes, take a deep breath, take that time that you need for yourself. No baby has ever died from crying. However, when we shake a baby out of frustration and not knowing what to do, that can cause brain damage, injury, and it can even lead to death. So they've provided you with lots of literature about that. If you want to go ahead and look through the information that we've given you, if you have any other questions or concerns, or you just feel like you need some extra help, just let us know. We're always here for you. Do you have any questions about the baby assessment or education? No? Okay. So now we're going to focus on you, Mom, and we've already talked about a couple things. We've already addressed the mastitis, which is the hard, painful spots, redness, and that can be early signs of mastitis, okay? Which is an infection that does need to be treated with an antibiotic before it gets too bad, okay? If you were to develop a temperature of 100.4 or higher, we would also want you to call your physician, okay? We reviewed the lochia. That is the rubra, which is what you have right now, which is a bright red. That is going to go to serosa, which is that light pink, and then to alba, which is the yellowish to white. Now that is expected. We would want to see it progress that way. However, if you're taking any steps backwards, so for example, if you go to alba to serosa or serosa to rubra, if you start to pass any clots, large clots, or tissue fragment, we would also want you to notify your healthcare provider right away, okay? If you develop any pain or burning with urination, that can also be a sign of an infection, so we would want you to notify your healthcare provider. And then lastly, because you had the C-section, you're going to want to monitor for those signs of infection, which is redness, swelling, drainage, or odor that is coming from your incision. Those can also be signs of infection, and it does need to be treated right away. Do you have any questions regarding any of our teaching? No? Okay. I'm going to go ahead then and document your assessment. I'm going to go ahead and lower the bed, put your side grill up, and your call light's right here. If you need me, just let me know.